Welcome back, everyone. This is Dr. Christina, your resident acupuncturist. And today I have another video on cupping covering elbow pain. Whether you're an avid tennis player or golfer, or maybe you are a climber or someone who works with their hands like I do, maybe you're a massage therapist, maybe you're a physical or an occupational therapist, or maybe you're just someone who uses their forearm muscles a lot in their daily life, you may have experienced elbow pain. I have been dealing with medial elbow pain for some time now, and I've received acupuncture and it helps. But unfortunately, because this is a repetitive type of stress on my joints, I continue to experience this pain even though I get relief for a period of time. So, one good thing that we can do to address this type of elbow pain is to apply my favorite cupping therapy. And specifically today, we'll be covering the medial aspect as well as the lateral aspect of the elbow pain. Medial elbow pain is also known as medial epicondylitis because if we go into our anatomical position, the inner portion of our elbow is on the medial aspect of our body, closer to the midline. So that is called medial epicondylitis because the attachment, the common tendon for the flexor muscles of the forearm attach proximally at the medial epicondyle of our humeral bone, which is our upper arm bone, while the lateral elbow pain is known as lateral epicondylitis and originates at this common tendon on the lateral epicondyle of our humeral bone, where a lot of these posterior forearm muscles, which are the extensors of the wrist and fingers, um, attach proximally, right? So we have the proximal and distal attachments in our muscles. Now, medial epicondyle or medial epicondylitis pain is also known as golfer's elbow, while lateral epicondylitis or lateral elbow pain is also known as tennis elbow. And the reason for that is just because of the type of movements that these two sports consistently involve the practitioners. So with tennis, we're constantly doing this backhand action, and with golf, we're swinging this way. So we're focused on that medial elbow aspect to really get that good swing. So, as anything with repetitive movement, like I said previously, we can strain the joints and that causes pain. Chronicity of it is usually due to inflamed tendons. So, let me approach this self therapeutic massage today by using a little bit of oil. So, I'll apply some oil. I usually go anywhere between a quarter size or a little bit less of oil in my palm. I rub the palms together and then I'll apply the oil over my forearm. I'll do both lateral and medial aspects, meaning anterior and posterior muscle tissue as well, just because I'll be showing you for both medial and lateral epicondylitis. If you haven't seen my previous video on cupping, please check it out over here. And it shows how you can help yourself if you're suffering from neck and shoulder pain. All right, now that my forearm is nicely oiled up, but not too much, you just want enough for the cup to be able to suction on properly. And then we'll do some TDM, which is a tissue distraction with movement type of cupping methodology that I will apply today. So, what you might need if you want to try this on yourself or a loved one or a friend, I'll be using a silicone cup. So the silicone cup is like this. I'm using the smallest size that came in my kit. Depending on the size of your own forearm or the person that you're trying this on, you may need a bigger cup. But for my little forearm, this is all I need today. So I'll start with the medial forearm and elbow. Right here in the crease of the elbow, I generally feel the pain slightly superior or above the elbow crease and in the joint itself. So I'll apply the cup, squeezing it like this between my fingers and applying it right there at that medial epicondyle of my humeral bone, so above the elbow crease, like so. And you can just first test to see how your tissue responds, making sure that it's not too painful. You can always apply less or more suction. And then I'll start to slowly start to move this cup down my forearm, so proximally to distally, and then I'll reapply again at that elbow crease or right above the elbow crease, and then move the cup down my forearm. And I already see this beautiful shot that the blood is invigorated, bringing all of that toxicity, toxins in the muscle tissue and slowly changing this metabolic state of my tissue by performing this sliding cupping method. Now, what you can also do is move your forearm while you're moving the cup. So we go into flexion of the elbow, wrist, and fingers, apply the cup right where that painful area is at the medial epicondyle. And then as we slide the cup, we're going into the opposite action, which is extension of the elbow, wrist, and fingers. And we'll do that a few times, making sure that we can tolerate this properly. And then you can also go in the opposite direction, so from distal to proximal, and see how that feels. And again, you can do some movement here as well. It's a little bit harder to apply the cup more distally because here we have more tendons and the wrist is smaller than the rest of the forearm where we have the bellies of the muscles. So that was the medial aspect and medial epicondylitis. Now we can move on to the lateral aspect for lateral epicondylitis. So this was for golfer's elbow, and this is now for tennis elbow. Now I don't play golf and I don't play tennis, but I do work with my arms a lot. I've also done aerial yoga and acrobatics for the past 14 years. So my forearms are very strong, but they also get very tight. So I definitely need this self massage work pretty frequently. Okay, and here as well, you can go above the elbow crease if that is where you're feeling it, and then just go down the posterior aspect of the forearm, covering those extensor muscles. And if you want, you can apply that pin and stretch technique that I showed on the medial aspect, which is engaging in the action of the extensors, which would be extension of the wrist and fingers, plugging the cup right above that elbow crease, and then as you slide the cup, you're going into the opposite action, which is flexion of the wrist and fingers, and see how that feel, how that changes the glide of the cup on the fascia and the muscle tissue. Try that a few times. And even though I really don't have any pain in the lateral epicondyle area or that lateral elbow, it just feels like I do have some tension in these extensor muscles. So I'm going to go over that area a little bit more. That's it. Lots of nice red shaw. And if you want, and this can be useful. But again, elbows and wrists are small areas, but you can apply a static cup. So I've showed this in my previous videos where I use Korean cups as they use a suction gun like this. So you'll place the gun over the top of the cup, and then you can place the cup right over the area where you feel that discomfort or pain. So for me, it's right around the elbow crease. Be mindful though, we do have a lot of other structures underneath the soft tissue here. So we have veins, arteries, and nerves. So just be mindful how much suction you apply. I'm gonna do 1 cup here, and that's about it for me in this area of the body. Now, if you find that it's not holding, you can do 2 pumps and see if your body can handle that. You take off the gun and then you just leave it here for a few minutes. You can try to apply some movement as well, flexion and extension. But like I said, these cups are not the best for this area of the body. Static cupping is better done on larger areas like the shoulders, the back, maybe even the thighs and calves, but generally not around smaller joints because the cups will fall off. So I'm doing this a few times, just allowing a, the tissue to come up to the surface, invigorate the blood and lymph flow in this area. And then you take it off, move the joint around. And generally speaking, you feel some type of relief immediately. Then the pain may return again while you're playing or using your arms in that chronic way, right? So I suggest some postural realignment and just keeping track of how you're using your body, whether you're a professional athlete or just to do something like that for fun and you happen to have this type of pain. So with that, I will end this video, and as always, please put it in the comments if you want more of these types of videos, and please don't forget to like and subscribe and share this with your loved ones and family. Talk to you soon.